Welcome to The Explainer. Man, I am absolutely thrilled to have you here today because we are tackling a massive and, honestly, a highly misunderstood topic, male hormone optimization. Specifically, we're going to map out Dr. Kyle Gillett's comprehensive pyramid of optimization. There's just so much noise out there about what guys should or shouldn't be doing for their health, but today, we're cutting through all of it and going straight to the science. We're going to build this pyramid step by step, starting from the absolute foundation all the way up to medical interventions. Okay, let's dive into this.
Here's the game plan for today. First, diagnosing your hormone baseline. Second, foundational lifestyle and diet. Third, science-backed supplement protocols. Fourth, the truth about TRT. And finally, prostate health and hair loss.
All right, part 1, diagnosing your hormone baseline.
Before you even think about tweaking your diet, popping a new supplement, or looking into medical therapies, we've got to know exactly what we're working with, right? Blood work is absolutely crucial here. Dr. Gillett has this brilliant analogy. He says, think about when a brand new car rolls off the assembly line. You do a full top-to-bottom diagnostic workup. We should literally be doing the exact same thing with humans. Ideally, guys should be tracking their development with blood work every 6 months, starting all the way back in puberty. You really want to see that progress across your entire lifespan so you know what your normal actually looks like.
Now, when you do get that blood work, you're going to see some confusing jargon. A big one is SHBG. That's sex hormone binding globulin. Imagine SHBG like a giant sponge floating around in your bloodstream. It's a protein that literally binds up the androgens and estrogens in your body. So why does that matter? Well, if your SHBG is too high, that sponge is soaking up all your testosterone. That means you have less free testosterone available to actually act on your cells and give you all those positive benefits. This is exactly why just looking at your total testosterone number isn't enough. You've got to check both total testosterone and SHBG, or just look at your free testosterone to get the real, full picture of your hormonal health.
Moving right along to part 2, foundational lifestyle and diet.
Okay, so once you've got your baseline, we have to build the foundation. And honestly, this might be a tough pill to swallow for some, but it's the truth. Supplements and medicines absolutely cannot patch up bad lifestyle habits. You just can't hack a bad routine. Dr. Gillett lays out 4 main pillars here. First up, diet. You want adequate dairy, which boosts IGF-1 for bone and tissue growth, plus vitamin D3 and prebiotic fiber. Think of your gut microbiome like a fish tank. That prebiotic fiber, that's the fish food, keeping the whole ecosystem healthy and thriving. Next is exercise. This is super fascinating. You definitely want to train 3 to 4 times a week, but the data shows that going super hard, like vigorous training for more than an hour at a time, is actually hormonally unhelpful. It just spikes your stress. And speaking of stress, that's our third pillar. You absolutely need solid coping mechanisms so stress doesn't completely skew your hormones and wreck your sleep. Finally, there's spirit. This is basically self-actualization, picking a life goal, crushing it, and then setting a new one. Your psychological drive literally impacts your physiological state.
And real quick, before we leave the diet pillar, we need to bust a massive internet myth. Doing a pure carnivore diet in your teens and early 20s, it's honestly a terrible idea. Look, strict low-carb diets definitely have their place later in life for specific metabolic issues. But young guys are still actively developing. Forcing your body into an extreme caloric deficit or completely starving it of carbohydrates drastically drops your free androgens and your IGF-1. You're basically robbing your body of the fundamental building blocks it needs to even synthesize hormones in the first place.
Okay, let's move to and see how this builds in part 3, science-backed supplement protocols.
Now we're getting into the highly sought-after world of supplementation to optimize those natural baselines we just established. But right out of the gate, we've got to address the elephant in the room. Does taking creatine accelerate hair loss? You see this fear everywhere on the internet. And look, creatine is incredible. It's like a backup fuel tank for your mitochondria's ATP, and it really helps with amino acid synthesis. But it does slightly increase the conversion of testosterone into DHT, which is the main hormone linked to male pattern baldness. So what's the deal?
Well, here's the verdict. No. Hair loss is a really poor reason to avoid taking creatine. You have to remember, creatine isn't some magic steroid. It's not going to push your androgens to supra-physiological levels. It literally just resets your natural balance. So if you're a guy who naturally converts a lot of testosterone to DHT, creatine just brings you up to your normal, natural baseline. It is absolutely not going to speed up hair loss beyond what your inherent genetics already dictate.
So let's walk through a few highly effective science-backed protocols for optimization. First, you can actually upregulate your entire steroidogenesis cascade, which is basically just the assembly line that makes testosterone by taking 300 to 1200 milligrams of Tongkat Ali daily. Just make sure it has high uric-mono standardization. Then, to bump up the release of luteinizing hormone from your pituitary gland, 300 milligrams of Fedosia is a solid, safe dose for humans. That specific dose completely avoids the toxicity issues that were seen in some rat studies, which is great. Now remember that SHBG sponge we talked about earlier? Boron is fantastic for lowering that. Just 5 to 12 milligrams a day does the trick. And finally, for the guys out there who just don't seem to respond to creatine, betaine is an awesome alternative. Taking 1 to 3 grams a day really helps with that amino acid synthesis.
There is one more powerhouse supplement I have to highlight: L-carnitine. L-carnitine acts like a shuttle, actively pulling nutrients right into your mitochondria. And amazingly, it actually increases the density of androgen receptors in your cells. Basically, it gives your existing testosterone more docking stations to plug into. But there's a massive caveat here if you're taking the oral version instead of injecting it. Because oral bioavailability is super low, you have to take a massive dose, like 1 to 5 grams. And doing that can actually cause your gut microbiome to churn out a potential carcinogen called TMAO. No thank you, right? To stop that from happening, you absolutely must pair your oral L-carnitine with a garlic compound called allicin.
All right, part 4, the truth about TRT. We are now stepping into the very top tip of the optimization pyramid. We need to take a really objective look at this massive modern trend of younger and younger guys seeking out testosterone replacement therapy, or TRT. First off, it's important to understand how the medical approach to TRT has totally shifted. The old school method was honestly pretty brutal. Doctors would just give this massive 200 milligram plus injection once every 2 weeks. It caused this huge, unnatural spike in hormones, followed by an absolutely miserable crash. Today, the modern physiologic TRT approach uses 100 to 120 milligrams a week, but it's divided into much smaller doses injected 2 to 3 times a week. That way, it actually mimics the body's natural rhythm. But here is a huge reality check for you. Young guys in their 20s and 30s almost never actually need TRT if their lifestyle is properly dialed in.
If you jump on TRT when you don't actually need it, you are opening the door to a whole host of complex issues. We're talking severe cystic acne, cardiovascular and microvascular ischemic disease, major lipid spikes in your ApoB and LDL, and severe mood shifts that can literally induce manic or bipolar episodes. Oh, and of course, suppressed fertility. So the crucial point is this: if you do genuinely need TRT, you cannot just rely on a single doctor. You really need an interdisciplinary medical team. A dermatologist, a cardiologist, a lipidologist, to safely monitor all of these interconnected systems in your body.
And finally, part 5, prostate health and hair loss. Let's look at some really niche pharmacological interventions specifically geared toward keeping your prostate healthy and protecting that hairline as you age. Get this: a low daily dose of 2.5 to 5 milligrams of tadalafil, which most people know as Cialis, is increasingly being prescribed by doctors, but not for erectile dysfunction. It's actually prescribed for prostate health. Specifically, it can cut nighttime urination, known as nocturia, right in half. That drastically improves your ability to get unbroken sleep, which in turn, secondarily, optimizes your body's natural testosterone and growth hormone production. Plus, much like L-carnitine, it has this incredibly unique effect of increasing your androgen receptor density.
Now, when it comes to fighting hair loss, a lot of guys really want to avoid oral medications because they're terrified it's going to kill their libido. And while weak topical interventions like caffeine or ketoconazole shampoos can lightly crowd out DHT on the scalp, stronger interventions are usually needed. Topical finasteride is definitely effective, but because the molecule is so small, it still absorbs into your bloodstream and actually drops your total systemic bodily DHT by about 30%. Topical dutasteride, on the other hand, is considered vastly superior by a lot of experts. It has a faster half-life at lower doses, which means it does its job right on the scalp, but results in zero drop in your overall systemic DHT. So it protects your hairline while also protecting your overall sex drive and vigor.
Well, we've covered the entire pyramid today, from blood work and diet all the way up to supplements and TRT, which leaves us with this final, really vital question to think about. In the modern pursuit of health, are we seeking to truly optimize our natural baseline, or are we just obsessively chasing arbitrary numbers on a blood test at the cost of our body's delicate balance? I really encourage you to respect your body's incredibly complex hierarchy of needs before jumping straight to extreme medical interventions. Thank you so much for hanging out with me on The Explainer today, and keep learning.